Charter Local Edition. I'm Brad Pomerance in Nashville, Tennessee, State Capitol. We are joined by Johnny Shaw. He is a member of the Tennessee House of Representatives. And sir, I'd like to speak with you about health care and health care reform. As we know, a few years back, the Affordable Care Act was passed, and ultimately the U.S. Supreme Court upheld the Affordable Care Act, but indicated that states had the option whether to accept the Medicaid expansion.
Right.
Out of the gate, Tennessee did not accept the expansion, but last year, the Republican governor moved to work with the federal government to create a plan that would allow for expansion. The program was known as Uninsured Tennessee. What did you think of that plan, sir?
I thought the plan was great. We got, we had a special session. We got called back for special session. I waited in my office for 2 days waiting to take a vote. I was excited about it, but unfortunately, about 7 people decided in a committee that we weren't going to vote on it.
Which was disappointing to many, both Democrats and Republicans.
Yes, it was.
Remember, it's a Republican governor that had negotiated with the Obama administration to create a plan similar to what other Republican governors had done.
Right.
In Indiana, for example, there are red states that have adopted the expansion. What would have the expansion done in your mind?
Well, first of all, it would have given us back the money that belonged to us. That was the one issue that I really had with not passing Uninsured Tennessee. It was our money. The government, Washington, got our money, and they're still holding our money because we refused to take it back. It would have not only provided primary insurance for over maybe 300,000 people, but it would have created several jobs for people. I got a figure one time of at least 90,000 or more jobs.
So in the final analysis, we still have these 300,000 Tennesseans that are uninsured. From where are they obtaining their coverage?
Well, I think the affordable health care provides some of them who can afford it.
Yes.
But I don't know how many of those 300,000 can afford anything through the affordable health care system, because I understand that's a pretty high way of insuring yourself. But so it's probably most of them are just sitting there with nothing.
So who pays when they get sick?
We pay.
Tennessee.
Tennessee pays, because we have a right, and we have to honor people in emergency rooms and hospitals across the state. We have to do that. Yeah.
There had been some concern that under the expansion plan, the federal government would pay 100% of the expenses.
Yes.
But then that money would drop to 90%, and then possibly 80%.
Yes.
So some legislators expressed serious concerns about that. What's your sense of that element?
Well, I remember having a conversation with the governor, myself, and some other caucus members, and here's what we suggested. Let's take our money at 100%, and once we get to the sharing part, if we can't afford it, let's sunset it. Let's take it under the sunset law to say, if we can't afford this one, we have to pay 5% or 10%. We'll just sunset it, and we'll say to the citizens of Tennessee, hey, we done what we could with what we had.
But if you do a cost-benefit analysis, maybe it's been done. For argument's sake, let's say that Tennessee winds up having to pay 10%. Is that 10% more or less than what Tennessee's already paying for the uninsured?
Probably it's less than what Tennessee is already paying. I would think it would be,
So are your friends on the Republican side, are they looking at those numbers, the fiscal conservatism?
I don't think so. I really don't think. I think most of the people who have made up their mind, we are against this. And to be perfectly honest, I think most of them were against it because of Washington itself, the interaction, the contact we had. I mean, I heard all kind of conversations in the hallway about why I wouldn't vote for it. Some I don't really want to bring up, but
there was a lot of. It was more about President Obama than about.
Sure it was, and about Uninsured Tennessee.
So let's, for argument's sake, presume that Mrs. Hillary Clinton becomes president in January of 2017. Do you think that might change the conversation about Uninsured Tennessee?
I don't think so, as long as the House and Senate is in the posture that it's in. I really don't. I don't envision getting although, I mean, I will publicly admit Hillary is my candidate. But I don't think it's going to change a whole lot unless there is a big change in the House and Senate.
Let's say, for argument's sake, the House and Senate in Tennessee remain in Republican hands, but the Democrats pick up some seats.
Yeah.
Could that move?
I think that could.
Okay.
That could have some bearing. I don't know how much, but it could. But I do know that it's going to make some changes just by Mr. Obama leaving the White House. I've also heard that statement made that we'll get something done when he leaves the White House. You know, everything's just hinging on, you got, 10 more months.
Right.
As soon as you get out of Dodge, we'll try to do some things.
The Democratic leader, Mr. Craig Fitzhugh, has proposed that the expansion question be sent to the voters. What do you make of that? Before I tell you what happened with his proposal, what do you make of that?
I think that would probably be one alternative. I don't think we'll get that done.
Right,
But
and you didn't because ultimately the committee killed it.
The voters would say, we want insured Tennessee.
You do?
Yeah.
So
sure.
do you believe that's why the committee ultimately opted against?
I think so.
I want to shift gears and talk about transportation in this great state. Let's face it, it's getting crowded in Nashville. It's getting crowded in Memphis. Maybe not in your county, but it's even getting crowded.
Even getting crowded in Baltimore.
Okay, so let's talk about that, because since 1989, the gas tax has been the same in Tennessee. And when you consider that construction costs are more, when you consider that inflation is a reality, when you consider that we have vehicles that are more fuel efficient, even some that don't use fuel at all, those dollars aren't going very far.
Right, and you consider gas prices are down.
And dropping.
Yeah,
right.
dropping. So,
so this governor, this Republican governor, seems to be at least interested in the conversation
I think he is,
about increasing the gas tax in some way. I've even talked to some of your Republican colleagues who've said, you know, it's not really increasing a gas tax, it's a user fee. So you can see they're looking for some room on here. I don't know if it will happen this session, but do you think in this decade we may see some movement on the gas tax or gas fee, we'll call it?
I think we will, because I think the governor is probably counting his votes as we speak.
Right.
You know, this is the time in the legislature when, if you will, deals are cut.
Right.
You know, you say, look.
Towards the end of session.
Look, I'll be glad to vote for the gas tax, but here's what I need for the gas tax. I need a road for the gas tax.
Of course you do, right.
But I know he's counting votes, whether he'll get those votes or not. But here's, from my standpoint, I would rather, before I leave here, vote for a user fee tax.
Sure.
Go home, say to my constituents, I did this because we need better roads. We need safe roads. We need our kids, everybody to be safe. Then to go home and ask to be reelected and come back and then have to do it, because ultimately it's got to be done.
So as you know, Tennessee Amen has a surplus right now.
Yes.
About $2 billion when you consider recurring and non-recurring. Have you spoken with the governor or otherwise about maybe using some of that surplus for some road repairs? You know, it's one-time money, essentially.
I have not, but I think that could pose a problem, because the question is, what roads would you use?
Of course you talk about.
And so, I mean, if I don't get some roads out of it, hey,
who's voting for that?
Yeah, sure, who's voting for that? So I think that's where you might create a problem. But what I think we should do is just pass that user fee tax, fuel tax.
Right, whatever you want to call it.
Whatever you want to call it that. Let's get it done. Let's fix our roads. Let's make our roads safer, because, you know, now Tennessee has some pretty good roads. Even though we have not had a user fee tax in a while, when you get to Tennessee, you can tell you're in Tennessee.
When you cross one of those 8 boundaries,
yes,
those
and
8
we
states.
want to keep it that way.
Have your Republican friends warmed up to it? Do you have a sense?
Not as many as I would like to.
Right.
You know, Republicans, one thing about Republicans, they're afraid of any kind of taxes. Even if it's for the good of the people. Over 30 or 40 years ago, they started that phrase, no new taxes.
Oh, yes.
And, oh, man, that has haunted them to the very end of the line.
His name is Johnny Shaw. He is a member of the Tennessee House of Representatives. My name is Brad Pomerance, and this is Charter Local Edition.